ER doctors and nurses. Have any of your patients surprised you with their amount or lack of pain tolerance? Story 1A friend told me an old boy came in with a large laceration on his arm. Suturing it up took over an hour, but can be quite fun as you can chat to the patients. My friend was engrossed talking to him about his experiences in the Second World War and really enjoyed treating him. The old chap was in good spirits throughout and told him lots of interesting stories about his time behind enemy lines or in trenches in Flanders. After he put the last stitch in, my friend started clearing up and found the local anesthetic bottle. Unopened, he realized had not put any local in at all, and yet the guy didn't once flinch leave his side complain. When asked why he didn't say anything, he just said, "Oh, I thought that's how it's supposed to feel. I didn't mind. Lovely chatting to you." Then walked out. Don't make him how they used to lignocaine edit. Spoke to my friend last night. I totally didn't do this story justice. The laceration was sustained in a machete attack. Two guys tried to break into the man's house, and one slashed at him, but he fought them off long enough until a neighbor started to run over, and they scarpered. Such a relevant detail. How could I have forgotten? He had to clean the wound out thoroughly, which is even more painful than suturing. And to those of you pointing out the Flanders inaccuracy, that's purely my incorrect paraphrasing. It was WW2, so ignore the trench comment. It'll refrain from the obvious in a Dr. Jim, not a historian line. Or perhaps I want. Story 2 ER doctor here. My intern year in residency, I saw a 17-year-old kid who, while playing hockey, tried to stop a puck with a gloved hand. It struck his fingertip, injuring the base of his nail, causing a significant deformity. His nail bed needed repair, which requires first removing the nail. That is done by bluntly dissecting reed, separating the nail from the tissue below it. If your stomach didn't turn reading that and imagining it, congratulations, you have no soul. Typically, we use a numbing agent to eliminate sensation to the entire finger using something called a digital block. I put it in. After 10 minutes, he still felt me touching his fingertip. I tried putting some around the nail. He still felt everything. His mother said his father actually had a similar thing. Lidocaine didn't work on him. I offered him a different numbing medicine. We can inject Benadryl in that case, or even knocking him out. He looked at me in the eyes and said, "Doc, just take it off without anything. Yeah, it's fine. They fix our cuts without numbing medicine, but it's going to hurt a lot. I have to scrape. I know." So I went at it. He grabbed a towel with his other hand, and I went to work. 45 minutes later, the nail was off. He was repaired, and I replaced the nail in its rightful place. The kid didn't even make a noise. TLDR. Hockey players are. Story 3 fire medic here. Farmers seem to be tough. One time a guy pulled into the front ramp, got out of his truck, and walked up holding his severed forearm in his other arm. Get him in the truck, take off. Along the way, he states he lived down the road and wanted to get to us quickly. When asked why he didn't call 911, he replied, "I just cut my arm. I ain't dying." Also had a battle of the bulge vet tell me he didn't need a blanket. It was -7 with wind chill. Story 4 ER doc, 50-year-old guy with a massive heart attack just lying there chilling. Asked him his pain level deadpan. Just a little. 5-year-old boy with both forearm bones fractured and dislocated, playing on iPad with other arm. 60-year-old lady slips, falls, destroys pelvic bone. Just wants one Tylenol and scooches out of bed wanting to walk home. After much convincing, she begrudgingly accepted that might not be a great idea. There are some bad people out there. Some edits. 1, yes, I'm aware there's silent heart attacks. 2, there are 2 bones in the forearm. He broke both bones in the same arm. Unfortunately, he does not have a third arm. Story 5 EMT here. I once took a kid about 18, 19 to the ER, screaming all the way for sunburn. Sunburn isn't fun, but this kid was claiming 910 pain and whimpering. I was astounded. Charge nurse, and I giggled about it for weeks. Edit, a lot of you have suffered from some horrendous sunburn, it seems. Ouch. That does sound like some squirm-inducing pain. This guy was barely pink and hadn't tried anything on his own yet. Story 6, I was a tech in the ER when the EMTs brought in an elderly woman with what they said was a sprained ankle. She had slipped while mopping a floor at work, and her coworker had called in. Turned out she had broken both of the bones in the lower part of her leg, but was sweetly chatting with us. I was impressed as soon as I saw the x-rays. EMTs had no idea and had splinted her ankle over where her bones were broken. Story 7, not a doctor, but my goddaughter was born very prematurely, requiring a major open heart surgery at 2 weeks old. We were told by her docs that since she had gone through so much surgical trauma the first few weeks of her life, as a neonate, her pain receptors nerve endings would not develop normally. They gave us the example that if she put her hand on a hot stove as a kid, she would have sustained a severe burn before feeling any pain whatsoever. She never cried as a kid when she got shots, fell down, banged into things, even when it was enough to draw blood. I suspect her medical history was the cause. Story 8. Working in a hospital has taught me the downside of abusing painkillers. Drugs. Patients constantly come in here with long-term substance abuse issues, and now that they are actually hurt, MVC, broke bones, etc., you can give them enough drugs to put down a horse, and they still feel everything. Story 9. ER doctor here. I can't count on two hands the number of patients I've seen. They're covered in tattoos and are scared of needles, IVs. I mean, complete phobia. It makes absolutely no sense. If anyone can enlighten me as to how this phenomenon can exist, I'd appreciate it. Edit. Thanks, guys. Seems like it's the appearance, depth, and the associated pain when things don't go correctly that create the aversion. Story 10. I had a patient with an open tib fib fracture the bones in the lower leg sticking out and below that it looks like jelly trying to walk away, apparently unaware of how bad his leg was. Of course, he was incredibly drunk at the time. Story 11. Radiographer here. As a student, I met a patient who was a typical little old lady. She came in with far too many shopping bags and walked extremely slowly. She had been sent by her GP because she had fallen getting out of the bath a few weeks previous. So we brought her in and took the first image AP pelvis, if you were wondering, and her pelvis was absolutely ruined. Turns out she had slipped and fallen with one leg in and one leg out of the bath and taken a whole fall on her vagina. Not wanting to cause a fuss, this woman had ignored the pain and carried on her life as normal for weeks, long enough for the fractures to be fairly healed, albeit in a strange way not really resembling a pelvis much anymore. Story 12. Not ER, but actually a cashier at a fast food place. A woman ordered 2 meals, and since she was a little older, really old, actually I offered to bring her food to the table so she wouldn't have to wait. I get there, and her husband had wads of paper towels stuck all over his arms with electrical tape, and his right hand apart his face were a mix of blood and second-degree burns. Turned out he was working on his lawnmower, and the engine blew up on him. They stopped for lunch on the way to the hospital for burns, and the metal they couldn't get out. He was acting like it was nothing. Story 13. I was chatting with my physiotherapist one day about pain tolerance. She said that she once had an maybe cocaine addict as a patient whose tolerance was absolute 0. She couldn't even touch him without him perceiving it as painful, let alone stretch or manipulate his body. She said he was a very challenging case. Edit. Fix spelling. Story 14. Working as an EMT. I got called to a 64-year-old female, slipped in her house, possible sprained ankle when we got there. The woman is sitting in a chair with her legs stretched out in front of her, but she had long pants and slippers on that covered the entire ankle, so I couldn't really see it. When we walked in, she was talking and didn't really seem to be in any pain at all. So I figured this was going to be an easy trip. I kneeled down in front of her to take a closer look, and wasn't I surprised to find that it wasn't just broken, it was right up. I mean, the foot was at a 90-degree angle to the outside, and it was also leaned down, so what should have been the side of her foot was facing straight down. And the bone that should have been holding the ankle in place was pushing against the skin on the inside of her ankle so hard that it was about to rip through. I was bewildered at the fact that at that moment she said, "It doesn't hurt, so I hope it isn't broken." She hardly made a peep on the ride to the hospital, 35 miles, very bumpy. Come to find out she had multiple sclerosis, and that makes people feel pain differently. Story 15. Not an ER nurse, but a medical technician at a couple of large events in my country. Working at a racing track, I had both of these people come in on the same day. Male, 54 years, Swedish, small cut on hand. His reaction to me pouring water saline in his wound. OW. It hurts when you put disinfectant in there. Be careful. Male, 32 years, Finnish, deep cut in right forearm. His humeral bone was visible. No, it doesn't hurt. Now just tape it up so I can get back on my bike. Edit. Yes, I mean the humorous when I say humeral bone. And yes, I mean the upper arm, not a native English speaker. And also it's 1 a.m. Story 16. Not a doctor or nurse, but this happened to me. I completely shattered my knee and part of my leg after I was running and slipped on some ice into a stone wall. I was with a group of friends, and all they saw was me slide and hit the wall. They came over and asked if I was okay. In a normal voice, I said I couldn't move my leg. No tears, screaming, or anything. No one believed me. But after a minute or two, I convinced them to call 911. The whole time I was waiting for ambulance, about 30 minutes, I was talking to them normally, and no one believed I was actually hurt until I started going in and out of consciousness. Right as the paramedics got there, I started to wake up. They got out, and they didn't think anything was wrong until they cut my pants off and saw my femur was almost protruding out of my leg. I had no kneecap, and tops of the tibia and fibia were protruding out. They took me to hospital, no drugs in the ambulance. As I was joking around with them, asking if I'm allergic to anything, I told the apparently stone walls. They got me to hospital and rushed me into ER. The doctors came over and were shocked I wasn't screaming or crying. Then about an hour after the initial injury, the pain finally started, and once they started moving the leg, about 3 doses of morphine, because one wasn't enough, and one of Demerol. I don't remember the next couple days besides bits and pieces, but all the nurses and doctors told me I had one of the highest pain tolerances they have seen. Although I imagine it wasn't really my choice, mostly the brain just shutting it down, because I was in so much shock and had so much trauma. Story 17, I've had a few patients in triage swear that their pain was 1010 while eating, drinking, laughing, playing on cell phone. Ill chart whatever number that they said, and then put in the notes, patient laughing, insert verb or emotion. I had one nurse that when a patient would say a certain number, she'd hand them a card that would say, at a pain level of 7, you would be sweating, vital signs would be elevated, you would be nauseated and probably vomiting. Then she'd ask, you sure you're a 7? 910 would change their answers. Story 18, my dad has an unusually high pain tolerance. He was cleaning a fishing pole in our backyard once when he didn't notice that the pole had splintered and pulled his hand down on it. The force caused the pole to snap in half and drive itself all the way through his hand. He stood up, walked in the kitchen with pole hanging out of his hand, and calmly asked my mom if he should just pull it out or go to the ER. Since it was a fiberglass one, he opted for the ER, just in case something was broken off inside his hand. The list goes on and gets worse. The other was when he fell off a ladder and shattered his leg. The bone came through the skin, and he was bitchy about going to the ER. Story 19, I'm a nurse who used to work in orthopedics. The amount of people who would guzzle oral morphine was unbelievable. Older adults, ESP little old ladies, would just take 2 paracetamol and would be totally fine. Story 29, or doctor, but I went to the ER with my younger brother after a ski accident. My brother fell on his back off, quite a big drop, causing his sternum split open. A few runs later, he said he was sure something was wrong with his chest, so we eventually got to the ER. The doctor was shocked that he was able to continue skiing after it, and that he wasn't writhing in pain when it was touched. My brother's explanation was, yeah, it hurts, but I can't do anything about it. Edit writing to writhing. Story 21, med seekers and junkies coming down have the same level of pain tolerance. Barely touch the junkies, and they flip out due to pain, whereas the med seekers attempt that and overact. I saw a guy try to fake a seizure, and it was the funniest ever. He was curling his hands up like he had CP and leaning his head back to gather spit so he could foam at the mouth. Med seekers will always be allergic to morphine and need Dilaudid and Ativan. I don't think I have met anyone with a high pain tolerance. Some chick came in with cysts on her ovaries and declined meds because she was in recovery, so that is actually pretty bad. Story 22, nurse here while in school. I had a 7-year-old girl who had broke her hip by getting bounced off a trampoline. They lived a few hours out of town, and when it happened, they knew she was hurt, but not how bad, so her parents put her in the back of the truck and hauled her for 45 minutes to their local hospital. She got there, they did x-rays, and found it was way too bad for them to treat, and that she needed to come to us. They rushed the family out without anything for paying for this little one, for another hour plus ride to our ER. This girl didn't shed a tear. She was hands down the toughest patient I've ever had. Had a 19-year-old do the same while skateboarding, and I had to pull him out of the car while another nurse held his leg in place. Some people will amaze you with their strength and braveness. Story 23, I broke my wrist when I was 12 after a bad bike crash. I flipped the handlebars and landed on my neck and slid a couple dozen feet. The impact shattered my helmet. Anyway, in the ER, nurses are setting up in 4 in the arm that wasn't injured when I explained I landed on my neck, and it was hurting. They asked where, so I instinctively used my broken wrist hand to point. Every single person in the room goes, oh, and just kind of stops and looked at me, and I guess I was in shock because I kind of just looked around like WTF happened. Story 24, when I was studying nursing, I saw a man who had broken his knee in a motorcycle accident 3 days before. The knee was at least 3 times its normal size. The doctor asked him about the pain, and he told him it wasn't that bad. He was mostly annoyed at his family who had taken him to the emergency room. Story 25, my grandmother wouldn't take pain medicine. Not sure why, but even getting dental work done, she didn't want numbing agents. The only time I know that she took pain meds was some aspirin after getting T-boned while driving and hurting her shoulder. She passed away last year from ALS a few weeks before her 80th birthday. She was the most independent person I've ever known, and even having to rely on her kids for help, she didn't complain. Story 26, patients in a sickle cell crisis. I've pushed up to 14 milligrams of Dilaudid, 1-2 milligrams at a time, into these patients without a resulting change in vital signs or mentation. However, I've also seen young men competing in rodeos who have been stomped by a bull a few times come in with broken ribs and a pneumothorax saying it's just a scratch and declining pain medications. Story 27, not a doctor, but my doctor seemed kind of surprised when I went back for a post-surgery appointment and told him that I had not taken any of the prescribed pain medication after getting my tonsils out. I had what I thought was a good reason at the time, though. At the pre-op appointment, he said that the pain is usually worst on the second day. Therefore, he suggested that I take a partial dose of the painkillers on the first day, then take the full dose on the second day, and use as prescribed until I recover. For some reason, I decided that it was a better idea to not take anything at all on the first day and just wait to take the painkillers when the pain got unbearable. I kept waiting for it to get worse, and eventually got better. Oops. Story 28. I am a radiographer in an ER. We frequently have to move patients with broken bones to get our pictures. The elderly have a surprisingly high pain tolerance. I've seen elderly patients move limbs with obvious breaks to accommodate our needs without a peep. People with the least pain tolerance seem to be the younger crowd, ranging from 15 to 30. They whine and wail from the slightest touch, and more often than not, the ones with no breaks whine and scream the most. Story 29. Not a doctor, but I recently broke my femur. When it happened, the first 30 seconds was the most intense pain. After that, I was calm, not in much pain, and joking and such. The only nothings that hurt that could get really any reaction was moving me from stretcher to bed, then x-ray table, and then the worst but relieving pain. They put a boot made out of soft stuff on my leg, and then they pulled my bones were overlapped by 3 inches. Infill the bones were a little more lined up. Then they put a weight on the end, but during that time the nurse lady saw my face and a grunting face, I guess. And she said, "You can cry and scream if you wanted." To shook my head. My mom recently had a heart attack, so I didn't want to scare her. Story 30. Not a doctor, but heard a good one from my PCP. He had an older Marine that came in, reason being stiff neck and nausea. Does his normal workup, rules out C-spine injury, decides to test for meningitis, tells the guy to touch his chin to his chest, turn left, turn right, look up, nothing, tells the guy to stand on his toes and drop onto his heels, and the guy nearly collapses and then vomits on the floor. Doc asks, "Didn't it hurt when you touch your chin to your chest?" Marine replies, "Yes, it hurt. But what does that have to do with it? I'm your doctor. You're supposed to tell me when something is wrong." The Marine just looked at him with a slightly blank look on his face and said, "Oh, sorry, Doc. Won't happen again." Story 31. First time posting. When I was 8, I managed to squash 3 of my toes with an anvil, and I kept on walking. My dad, former EMT, said that he didn't know how I was still walking around. We bandaged it up and went to my doctor's on an emergency call thing he used to do, and they took an x-ray and came in with this really weird look on his face. I shattered 8 bones, and they had to do surgery to rebuild my foot. I've since been stabbed twice in quick succession, and the admitting nurse wondered how I was concussed while nearly bleeding out. Story 32. I'm an oncology nurse. My patients have some of the highest pain tolerances I have ever seen. They literally have tumors taking over entire cavities in their bodies. Huge masses pressing on places that aren't supposed to be pressed on and literally eroding through their skin, and they will ask me for pain meds when I have a second. It amazes me. Story 33. Probably late to the party, but this is about my dad. When he was a kid, he got in a really serious bike wreck that tore up his knee. The only doctor in his tiny town at the time was a quack, and to send him home with a few stitches. Hay race, the fun part, his knee was completely shattered, and he walked on it for 6 months. He didn't say anything, he just sucked it up and dealt with it because he hated whining and limped around without crutches or anything. He's a hero, because just imagining that makes me cringe. Story 34. Doc here. 54-year-old guy comes in with a heart attack, keeps telling us he's fine. He looked sick. When we begin switching out the EMT's monitors for our own on his chest, he says, "Don't worry about that. It is my elbow that is the problem." Not 2 seconds after he finished that sentence, he was dead. Luckily, we were able to revive him. I kept track of his case while he was upstairs, and he left the hospital alive and without any neurological deficits. Feels good. Story 35. Nurse here. There are, of course, exceptions to the rule, but generally, I see elderly with a much higher tolerance to pain than younger patients. An 87-year-old lady can have a fall, break her hip, and be resting comfortably, barely complaining of pain. But a man in his 20s can come in with the same type of fall and barely be bruised and be writhing off of the bed. Of course, it can pain med-seeking behavior, cultural differences in age, or just of the people in general, but this seems to be what I see on a daily basis. Story 36. RN here. When I was working as a student in the ER, we got a call about a transient male being brought after being attacked by 3 large pit bulls. I wasn't prepared for what I saw. The poor guy was just all gory. His nose and ears were bitten off. He had a large flap in the back of his skull that revealed what looked like his skull, probably wasn't, but that's what student me thought. He had skin flaps everywhere, deep wounds, and was just covered in blood. I try not to cringe when I took his blood pressure. When he was stable, the ER physician wanted to medicate him, and the guy said, "No morphine for me. Thanks, I'm not in any pain. Besides, that stuff is addicting, you'll never forget him." Story 37, I had a patient who was on his motorcycle with a child and was hit in an intersection by a drunk driver running a red light. Fortunately, it was right in front of the ER. The guy and kid get thrown off the bike. The guy got up, ran to his kid, and picked him up, and walked in the front door of the ER, maybe a block away. He got sent to me X-ray, pretty quick, and no pain meds had set in yet. He was taking the minor positioning I had to do like a champ and didn't really do more than flinch. I quickly saw he had a mid-shaft femur fracture in one leg, and the other leg's tibia and fibula were completely shattered right above the ankle. And he had a calcaneus fracture and dislocated AC joint as well. Adrenaline can give you steel. Also, just last night, I had a cop with both shoulders dislocated during an altercation, yet he managed to get up, relocate his right shoulder, and tase the guy twice before his shoulder dislocated again. He was in pain, but not anywhere near enough for me to think both shoulders were out. He's going to need his mom's help for a while. Story 38, when I was about 12, I fell on black ice and hurt my ankle. I knew it was bad, so I asked someone to call me an ambulance. I wasn't crying or anything when they put me in the ambulance. Paramedics told me, it's probably just a sprain. I get my x-rays and bam, ankle broken in 3 places and foot dislocated. I saw the paramedic as I was leaving the hospital, and he told me he thought it was nothing because I didn't make a peep. I did shed a tear about a week late because my leg was hurting. I get to the hospital, and the doc says, well, cut your cast off, but I don't think we're going to find anything. He leaves. The nurses take the cast off, and my entire leg is green, black, purple, blue, and I'm pretty sure some new colors that no one has ever seen before. Also had a bunch of pressure blisters, so the doc walks and looks like he's in shock when he sees my leg, and then leaves without saying a word. Then a new doc comes in and gave me a cool cast that I could take off to air out, and look at my leg. My pain tolerance tends me over. Also that doctor, ED, I just saw the post near the top, also a hockey player. Story 39, not an ER doc or nurse, but I worked side by side with an ER doctor. I saw an 8-year-old boy come in with a compound fracture to his left humerus upper arm. First thing I noticed was him strolling in, not a tear or grimace on his face, blood pouring down his arm, and a rag held down near his elbow. First thing I thought was he probably had a decent laceration to his arm, pretty tough, but nothing too impressive. I get into the room and see that the rag was removed, and holy, that's a bone sticking out his arm. How is this kid not bawling, and how did he just walk into the ER, barely cradling his arm? Right then I knew this kid was tough. Little did I know that he was about to become Superman. So, I'm sitting there admiring this gruesome wound and listening to his backstory. Apparently the kid was out with a friend riding a 4-wheeler when they accidentally drove into a ditch and flipped the vehicle. Kid was thrown and the quad rolled over his arm. This was about 4 miles out in the middle of nowhere over bumpy dirt trails. So of course he just jumps on the quad and rides the 4 miles back to his house with a bone sticking from his arm. Then has his dad just lacerily drives him the 30 minutes into town to the hospital and strolls on in. Best part, when the doctor said that they needed an x-ray of the arm, he just casually asks, before you move it, can I get a little pain medication? It sort of hurts. Most 8-year-old I have ever seen. Story 40, when my daughter was 5, she severed her ring finger in a door. I was making lunch for a picnic when she realized her teddy bear was in her room, and you can't have a picnic without a teddy bear. She went upstairs to grab it. When I heard a slam and one single blood-curdling scream, then silence. I ran to see what was the matter, and my little daughter was sitting on the floor in front of her door, covered in blood and staring at something. She looked at me and said, my finger is off, Mama. I wrapped her hand in a towel, picked up her finger, and called 911. In the ambulance, the paramedic was asking her questions about how much pain she was in, and she told him that it's the most hurty thing ever, but she was more sad that she ruined Teddy with her blood. They ended up being able to reattach the finger, but her Teddy was ruined. I tried to wash him, but it didn't came clean. The whole upstairs looked like a murder scene. I even washed blood off the ceiling. A few days later, the paramedic knocked at the door with the biggest teddy bear I ever saw. He gave it to my daughter and told her that she was the bravest little girl in the world. It was really sweet. Story 41. I had a patient, 60-something male, who had 3 of his fingers mostly amputated by a snow blower at about the level of the second knuckle. He came in with his fingers hanging from skin flaps and was totally stoic. Not only was he a 0 out of 10 for pain, his vitals were rock steady, no alteration in heart rate or blood pressure. He kept joking around about it. I just cut him off. They'll grow back. This guy remained a 0 out of 10 for the entire time, even when they just cut him off. His biggest concern was getting out of the ER in time to watch a football game. Stark contrast are the patients I get who scream murder and cry when the blood pressure cuff is pumped up on their arm. Grown adults, are you kidding me? Also, screaming and crying is only going to make your BP go up, causing that cuff to squeeze tighter and tighter. I have a high pain tolerance, but if you think I'm turning down a shot of morphine when offered to me in a sterile setting, Story 42. Eastern European guy had a circular saw accident that cut his leg down through the muscle. The wound was about 8 inches long, was covering trauma XURG that night, and got called down to sew it up. The ER had drugged him up, and I brought a med student with me, and I walked him through aggressively irrigating the wound, reapproximating the muscle, and doing a loose suture approximation of the skin. The student took some time, and we redid several sutures in the skin and muscle layers because they were too loose-tech. After about 45 minutes we were done, I asked the ER attending how much morphine he gave him so I could redose. He replied that he didn't order anything yet and was waiting for me. The patient's last dose was in the ambulance hours ago. I immediately asked the guy how he was feeling while injecting the Outidem with local. He said, "I feel fine." The guy didn't even flinch the entire time we were working. He was connected to a monitor, and his heart rate didn't even budge. TLDR, never get into a fight with a Lithuanian man or a circular saw. Story 43. I'm probably too late to the party with this story, but waitives, I'm a paramedic, and I had one point that blew my mind with their pain tolerance. We walked up on scene to footprints. They were normal prints except that one side was more of a drag, like was what her prints looked like. She had rolled her ankle at a restaurant and had her tibia bust right through her leg, and she was walking on the bone. She had driven all the way home when her neighbor called 911. Now the craziest thing was that she rated her pain at a 0-10. Just insane. Hey, raise a pic. I asked permission. Paramedic instructor told us this story. She responded to an elderly gentleman who had fallen in a nursing home and broke his femur. He was stoic the whole time she was doing an assessment, and when she asked him what his pain level is, he coolly responded with 4 or 5. She was completely flabbergasted since a broken bone, let alone a femur, would generally warrant a 10 to actively being mauled by a bear. She asked the nurses if they administered any painkillers, in which the staff replied they had not. At this point, both her and her partner were absolutely confused. It wasn't until she pulled up his sleeve to start in 4 that she noticed the barcode on his wrist. Edit barcode signified he had survived the Holocaust. Story 44. I don't think my pain tolerance is really any higher than normal, but I've surprised a few people. When I was about 5 years old, I fell and took a pretty good chunk of skin off the side of my head. We went to the emergency room. I was still crying pretty loudly and got into the room. My dad pulled the doctor aside and told him, "Don't surprise him. Just tell him exactly what you're going to do, and you'll have the best patient ever." So the doctor did. He explained that he'd have to shave around the wound, scrub it with a brush to remove any dirt, clean it again, and then bandage it. I said okay, and let him get to work. I sat quietly, wincing occasionally while he scrubbed my open scalp, but didn't cry or freak out. I knew exactly what he was doing, so the pain was completely expected, and I saw no reason to really react. The doctor was absolutely amazed and said he'd try that with all his patients. The 2 other times are more recent. One was a 6-5-hour tattoo session with no breaks, after which my artist called me a psycho. The other was when I broke a bone in my hand and told the ER doc that my pain was maybe a 3 or 4 on their scale. Edit remembered another one. I split my scalp open on the antenna of an F-18 and needed stitches staples. It was almost 3 hours before a doctor was finally ready to start stapling me up, and by that time I was sick of waiting while still oozing blood. He realized he had forgotten the numbing agent, and I told him, "Doc, look at how many tattoos I have. Do you really think a few staples are going to bother me?" He looked a little horrified for a moment, asked me if I was sure, and then finally stapled me up. 10 staples. Story 45. Not a doctor, but once I was bouncing at a club in a historic part of the downtown district where my college was located. Being in the historic district, the building had high ceilings and big, tall windows with thick, heavy glass. One night, some kid got upstairs and decided it would be a good idea to kick one of the windows out. Right over top of the crowded smoking patio out front, I felt a great weight come down on the top of my head and heard the sound of breaking glass. I thought, being that it was a pretty rough bar, that someone broke a bottle over my head. So I turn around, raising the dukes and ready to fight, when I feel what only could be described as my ear peeling off the side of my head. What had happened was a shard of glass about an inch wide and over a foot long connected with my head at the topmost point of where my ear connected to my head, slid down through my ear canal and lodged in the back of my jawbone, making it impossible to close my mouth properly. I turned to my boss, who was standing next to me apparently, because I don't remember this next part. This is what bystanders told me, and said, "Hey Mike, would you pull this out for me?" Went to the hospital, got Stitch Sans numbing aid, and made it back to the bar before close for a beer. TLDR, piece of glass almost cut off my ear and part of the side of my face. Got stitched without numbing agent. Went to get a beer after.